Hello, my name is Bernard and I'm going to discuss thyroid scan. According to Thyroid Foundation in Canada, 1 in 10 Canadians suffer from thyroid problems such as hypothyroidism, hyperthyroidism, and thyroid cancer. So what is thyroid? A thyroid is a small butterfly-shaped gland located in the neck. Normally, a pituitary gland works with the thyroid gland by sending signals back and forth in order to keep the hormone levels in balance. If there's a problem in the thyroid, normally a thyroid scan is used. So, the first purpose of the thyroid scan, it helps find problems of the thyroid gland. It finds areas of the thyroid gland that are overactive and underactive. It also checks the thyroid nodules. It shows the size, the shape, and the location of the thyroid gland. It also sees whether the thyroid cancer has spread outside the thyroid gland, such as these results. How's the test done? Before the procedure, normally a blood test is done to check the thyroid hormones. These are TSH, T3, and T4. Secondly, you may need to stop eating prior to the procedure. You may also need to tell your doctor that you have CT scan contrast within the last month. And your doctor may also have you to stop taking thyroid medications prior to the scan. What happens during the test? So the tracer used in this test is called radioactive iodine or technetium. You will either swallow the dose or it also can be given intravenously. For the scan, you will need to lie on your back with your head tilted and your neck extended, like in this picture. This is the example of the thyroid scan machine. For this, a special camera takes pictures of your thyroid gland from 3 different angles. So how long does this test take? After you get the tracer, you may have a scan about 30 minutes later, or you may need to go back up to 24 hours later for 1 or more scan. And each scan takes place only a few minutes. And after your thyroid, you can do your regular activities. So what diagnostic imaging department should the hospital unit clerk need to contact? So a thyroid scan is done in the nuclear medicine section of the hospital's radiology department, and the nuclear medicine technology is the one who takes in charge of you. So additional tasks you will need to be completed by the unit clerk. So as a unit clerk, I will first double check the client's information to see if I have the right client. I will also need to transcribe the diagnostic test and send requisition form in the DI department. I will also make sure that the nurse in charge is aware of the procedure. And lastly, I will also book a porter if the client is unable to walk. And additionally, I will check the diet order in the doctor's order. So what other departments would the hospital unit clerk need to be contact? So I will first contact the laboratory department if there's additional lab tests such as the T3, TSH, and T4, as I mentioned before. I will also coordinate on the dietary department regarding the client's diet because the patient needs to be stop eating before the procedure. And I will also inform the SPT if there's additional materials needed before and after the procedure. So as a hospital unit clerk, my role is to communicate with myriads of people such as nurses, doctors, and other departments. So I should have the knowledge and the skills needed to process the doctor's order regarding the laboratory and other diagnostic work. And then, as a unit clerk, I should learn the role of each laboratory department and the work the different staff perform in those departments. Thank you for listening to my presentation.